I'm Dr. Glenn Eisen. I'm the Editor-in-Chief of Gastrointestinal Endoscopy. Welcome to our author interview series. Today I'll be discussing push enteroscopy has a 96% cecal intubation rate in colonoscopies that failed because of redundant colons. I'll be discussing this with the first author, Dr. Christian Jackson, who is the Chief of Gastroenterology at the Loma Linda VA Medical Center. Dr. Jackson, welcome.
Thank you.
How are you today?
I'm very good. How are you?
So I'm interested in discussing this paper that's accepted for publication at GIE. I'm curious as to why you chose an enteroscope to repeat colonoscopies in patients who had incomplete examinations.
We had noticed previously that there was an article, a publication performed by Dr. Lichtenstein, which had very good success using a push enteroscope done years ago. And we were in a quandary on what we should do with our incomplete colons. If we were to send those colonoscopies across to the university, it would have been at a very extreme cost to the VA. We already had a push enteroscope in our endoscopic inventory, and we decided, based on what occurred previously in the literature and showed success, that with a newer scope, possibly we can achieve the same success, if not better, using the push enteroscope.
What was practice before you engaged in this study?
The practice before was to either repeat the colonoscopy with a different endoscopist, or to move to CT colonography, and much prior to that was to perform barium enema, and if there was something that picked up was shown on barium enema, then to move on to perform another colonoscopy. And unfortunately, there were a number of failures because of that, and once I joined the staff, I decided to use a push enteroscope to complete these colons.
So the change in regime did this, it looks like.
You could say that.
All right. And it looks like from the discussion in the paper that your cecal intubation rates for your group at the VA are excellent. You know, only 2% incomplete exams, which is well within what's considered acceptable. What type of adult colonoscope do you use for the initial exam? The
initial exam, we have now changed, but when this study occurred, we used we had two sets of colonoscopes. It was a Pentax 70 series and a Pentax 90 series. The majority of the scopes were Pentax 90 series with some Pentax 70 series. We did have some referral from an outside contracting facility where they were using the most current generation of Olympus colonoscopes.
Okay. Were any of these variable stiffening colonoscopes, or they're just typical standard?
Typical standard adult forward viewing colonoscopes.
Okay. So can you tell me about the reasons for incomplete colonoscopy in the cohort?
One of the issues were redundant colons. The majority of colonoscopies that were noted to be incomplete were redundant colons, predominantly in the proximal colon. That was the majority of failures occurred either in the transverse colon or proximal to the transverse colon. We did not see a lot of failures in the sigmoid colon secondary to diverticulosis or angulation within the sigmoid colon. The predominant reasons for failure were in the proximal colon.
Did you find any risk factors for incomplete colonoscopy, such as known in the literature, like elevated BMI or female gender? I assume there weren't that many since it's a VA study.
Correct. If I remember correctly, there was an issue. There was an issue with obesity. You're absolutely correct. Female gender really didn't play a role based on the cohort that we had being at the VA. But the main issue that I can remember offhand was elevated BMI.
Could you share with us the results of the study?
Sure. So one of the, obviously, as the title said, or I should say stated, 96% we were able to complete 96% of all incomplete colons with using our push enteroscope. One of the interesting things that we noted within the study was 38% of these incomplete colons were noted to have new findings, the most striking being polyps, and polyps being significant polyps, i.e. tubular adenomas or advanced adenomas. There was one gentleman that had a carcinoid tumor, which was found by us able to complete his colonoscopy, and there was one colonic ulcer that was diagnosed as well. We noticed that as the study moved along, that we were able to complete more colonoscopy, that our cecal intubation rate improved. I think in the last 37 cases, we had 100% cecal intubation rate, and I think that was just because we were getting more and more familiar with the scope.
So has this become the standard of practice at your institution, that for failed colonoscopies you'll proceed with a push enteroscope?
Absolutely.
And I noticed that about half the patients had it the same day.
Correct.
So they just have an incomplete case and another doctor rolled in and
That's exactly and I don't want to belabor this, but there has been some issue within the literature about incomplete colonoscopies or decreased cecal intubation rate and post-colonoscopy colorectal cancers. So we were very aggressive about completing these colonoscopies, and we have the opportunity to complete the colonoscopy on the same day.
So given the choices of endoscope after an incomplete examination, where do you think push enteroscopes fit amongst balloon enteroscopes, spirus endoscopy, and pediatric colonoscopies?
Sure. I think there's as you just said, there's a heterogeneity of techniques to use to complete incomplete colonoscopies. I think this for a VA setting or other types of settings which would not be able to afford a double balloon colonoscope or single balloon colonoscope, single balloon enteroscope or double balloon enteroscope. I think this is a more cost-effective and I think easier way to do this. I'm not stating that this is any better, but it's just another option that's in the quote-unquote armamentarium to deal with this particular issue.
Thank you very much, Dr. Jackson.
Thank you.